Let's have a conversation here. Democratic strategist Nicole Schmidt joins us now. So does NewsNation political contributor Denise Gitsham. Good to see both of you. We had both, comments live over the last half an hour or so from the congressional leadership. So let's start there. The Democrats go first, and it's Jeffries and it's Schumer. And, okay, then the Republicans come out. The vice president is with them. It's not just Johnson and Thune, but it's Vice President Vance. Let me start with Schumer. Here's a clip of Chuck Schumer after meeting with the president, part of what he said.
We laid out to the president some of the consequences of what's happening in health care. And by his face and by the way he looked, I think he heard about them for the first time. The closing of rural hospitals. The fact that so many clinics are closing. And I don't know if he knew this before, but the fact that people will pay $4,000 more a year, $400 more a month, close to $5,000 more a year on their health care premiums if we don't do anything.
All right. Nicole, you start us off. Pick up on that Democratic argument. That's essentially what Chuck Schumer's laying out. Then Denise can respond.
Yeah, I mean, look, this is the Democrats' hard line. I know the Republicans continue to say that there's so many points, but this is really what they're digging into. They know that the American people are concerned about healthcare. We're seeing hospitals announce their closures. We're seeing clinics announce their closures. Lots of people, myself included, have received an email from the governor of their state letting them know if they're on the exchange, this is how the premiums are going to rise because of new federal law in both blue and our states. Those emails have been received. So the American people and the Democratic base is very clear on where they are on this. And this is what they are going to hold the line on. It is not their job to vote for a bill that will increase healthcare premiums and cause people the inability to seek the healthcare that they need. And that is a demand from their base. That is a demand from their constituents. And frankly, we saw how it happened last time. Schumer got a lot of heat for what the Senate ended up passing. He knows politically that that is not something he can do again.
Yes, and I feel like that maybe is driving some of this and making him willing to shut down the government because of that tomorrow night. At one point, Joe Khalil brought this up as well, Denise, that I did think was interesting because Vance came out, the vice president, right after that and basically said, well, I don't think the president heard about this from Schumer for the first time. But then what he said after was really interesting. He said that they were willing to work with the Democrats, it sounded like to me, and this is what Vance said, on that issue, but he doesn't think they should be using it as leverage to get, quote unquote, everything they want. What would you say?
Right. Well, two things. First of all, a continuing resolution, a CR, is meant procedurally to continue funding what appropriation bills have already been passed. And so this is not a place for continuing negotiation. It's not a CN, it's a CR. Moreover, if Democrats were really serious about sticking only to their talking points about this being about healthcare, they wouldn't have thrown in the extra money for all of their pet projects. So let's be honest about it and let's look at what the Democrats have proposed, because it's not clean and it's not just about healthcare. And the thing that I think that's most important to point out is that Democrats are trying to fight to fix an issue that doesn't even exist, because the CR they're opposing only funds the government for the next 6 weeks. So that would expire on November 21st, when Obamacare subsidies are actually funded through December 31st. So they're fighting an issue that doesn't even exist for the next 6 weeks. What are they actually fighting for? All this is, it goes back to what you said originally, Nicole, as well. This is about politics, with Democrats being in the toilet on their approval ratings at record low approvals and afraid to ever agree with Trump on anything, even to the detriment of themselves, their party, and their approval ratings.
Well, I also think there's maybe some other areas where they feel like they can't do anything because the Republicans have the majority, and this is one place where they're needed. Otherwise, it can't pass, for what it's worth. Now, how are the Republicans putting this? I mentioned what J.D. Vance said. Here's the speaker, Mike Johnson, speaking a short time ago as well outside the White House.
A clean, continuing resolution, a short-term, nonpartisan continuing resolution. It's only 24 pages in length. Leader Thune has a copy if you want to see the exhibit. There's nothing partisan in here. No policy writers, none of our big party preferences, because we want to do the right thing by the American people and allow more time for negotiation. Now, there's a reason that Chuck Schumer and Hakeem Jeffries have come out here, stomped the feet, saying that they can't go along with this. They're trying to bring in extraneous issues.
What about that, Nicole? They're trying to bring in, quote unquote, extraneous issues, says the speaker.
No. They're focused solely on this healthcare issue, and they have to take every opportunity that they can because they are in the minority. right?
You think it's just that? I mean, the Republicans are saying they're using that to try to get other things. But go ahead.
No, they're trying to get health care done. This is their priority. Now, even President Trump knows, and he talks about it. You go into negotiations, you come in with some, the negotiation, you give a little, you take a little. This is the Republicans not being able to give anything. The hard line for the Democrats is the health care. And the reality is this is happening. I have an email about my subsidies going up. This is going to happen. The American people are frightened about this. People are going to lose health care. They're losing rural hospitals. They're losing clinics. This is a problem that America is facing, and the Democrats need to take an opportunity that they have when they have some leverage to try and fix this for their constituents.
Okay, that brings up a larger point that I want to ask you, Denise, about the timing of this, and also, you know, sometimes we talk about like political blame, which I'm not sure is the best way to put it. But one clip before we get to that, John Thune, Republican leader, after Johnson says the following.
This is sitting right now at the Senate desk. We could pick it up and pass it tonight. We could pick it up and pass it tomorrow before the government shuts down. And then we don't have a government shutdown. It is totally up to the Democrats, because right now they are the only thing standing between the American people and the government shutting down.
We hear this every time they have this debate, and you know, it's the Democrats shut down, the Schumer shut down, you know, and the other side's going to say it the other way. What about what Nicole brought up, though, Denise? If this happens, and also there are problems in, say, rural hospitals, there are problems with subsidies not being extended that real people didn't really realize was going to be an issue until it's an issue, then who gets the blame? How does that play out?
Well, if that's a concern, and it seems to be for everybody, including a lot of Republicans, then there's a time and a place for those conversations, and they should start now negotiations before the end of the year when the Obamacare subsidies end. Again, this is a CR for 6 weeks. This is addressing a non-issue because Obamacare subsidies, which is what we're talking about here, don't end until the end of the year. So why would you bring that up other than for political purposes? Moreover, if you got to go back and read what the Democrats proposed, there's $500 million to prop up left-leaning media outlets in this proposal of $1.5 trillion for a stopgap funding measure. So
Nicole,
if you're
talking about PBS and NPR, is that what you're referring to, like government funded?
You have to know what's actually in there. You can't say that this is all about medical stuff if you're going to add all this other left-leaning propaganda stuff in there. So you've got to be clear. Like, if you're going to be precise about what we're calling it, and stick to the talking points and actually show that in whatever it is that you're proposing. And then you would really put Republicans on the defensive, but not when you throw in all this additional junk that has nothing to do with your main talking points.
But when you bring up points like that, whether you're talking about NPR, PBS, and things like that, you know, obviously you Republicans, conservatives see it that way. Liberals will see it a completely different way.
I've been on those stations. I can tell you they're left-leaning.
What about but what about, Denise, at the same time, like the immigration, when they keep saying things like, well, they want to fund, the Republicans, they want to fund health care for illegal immigrants. But, you know, federal law already prohibits the use of taxpayer funds for, you know, undocumented people, right? So, I mean, like, there's a little bit of playing around with the language there. It's not literally what they're talking about. It's something else, no?
I mean, well, so in the state of California, where I live, where I'm speaking to you now from, there is lots of federal money that goes to supporting all the fact that we have Medi-Cal, which means that everybody, undocumented included, gets full access to health care.
So that's what they're talking about, things like that, not just giving like full benefits to people, right? But so I'm saying that everybody plays around with language is my point.
But it's also the people who are able-bodied, right? We had this conversation already when One Big Beautiful Bill was passed. Most Americans don't think that people who are able-bodied and capable of working should be able to rely on everybody else for all of their benefits. That's like gets 70% approval ratings from the American public. That's not even a negotiation issue.
Let me run right now. This is obviously an important discussion. We'll see what happens before midnight tomorrow. Thank you, Denise and Nicole.